So as of right now, we still do not have any confirmed cases of COVID-19 in the state of Alabama. What is new in the last about 36 hours is that the Alabama Department of Public Health now has been approved by the CDC and has capabilities in place to test respiratory samples for COVID-19.
We just got word that there's possibly 2 students at Jacksonville State University that were exposed. Is there any concern there at this time?
I just heard about this as well in the last about 20-30 minutes. What I have heard is that 2 students were exposed to a confirmed case. The local health officials and school officials are monitoring the case closely, but as far as I'm aware, the 2 students are asymptomatic.
It just seems like with cases in Florida and Georgia, that it's all around us and it's just a matter of time before it would get here. What would you say as far as it possibly approaching here?
We are actively monitoring the situation, and we are preparing as if cases are going to be coming at any time. We are always trying to be as prepared as possible. Right now we have no confirmed cases, but if a case is confirmed locally, we will be prepared.
What you know about the virus itself, the 2 students that were exposed to the confirmed case, how likely is it that they will develop symptoms and have the virus?
I'm not sure about their interactions together, and I don't know many details about that situation. It depends on how long they were together and what activities were ongoing in that situation. We do know that this virus is transported via respiratory droplets. So what we can do to protect ourselves and try and stay as healthy as possible is make sure that everyone washes their hands very well and very often, clean and disinfect surfaces well and often, and then if you're sick, try and stay home and call your healthcare provider for further questions.
I was going to say, if someone thinks they have the symptoms, what should they do? Should they stay home? Should they come to the doctor? Call the doctor first? What is the appropriate process if somebody thinks they have a symptom?
So what we're recommending is that anybody who is at home who has symptoms that they may be concerned might be similar to coronavirus, and those symptoms are fever, shortness of breath, and cough primarily, they should stay in their home and call their healthcare provider, whether their primary care doctor or a provider that they see regularly and often, for further guidance before they go to the doctor's office.
Don't just show up.
Correct. Do not just show up at the doctor's office. Instead, give them a call, let them know what symptoms they're experiencing, and they will get further information from their provider.
What sort of precautions do medical professionals like yourself need to take in possibly coming in contact with someone that may have COVID-19, things like CPR or things of that nature?
So as healthcare providers, we wash our hands all the time. We should be washing our hands with soap and water or hand sanitizer frequently and often, especially as we come into contact with our patients. If we have anybody who has respiratory symptoms coming through the hospital system, our ER, our clinics, the patients are asked to wear a mask, and we ourselves will don the appropriate protective equipment, whether that be gown, gloves, mask, whatever is indicated at that time. And that's to help us stay protected, but also our patients will then wear a surgical mask to protect themselves and protect from spreading any infectious respiratory droplets to other people.
We know like UAB and larger hospitals are pretty prepared for this. For the smaller clinics and like, I hate calling them doc in the boxes, but we know that's a pretty common term. For places like that, what is your advice for people who may go there with these symptoms?
The CDC and local and state health departments have been reaching out to all healthcare providers around our region, around our state, and around the country to try and inform all healthcare systems and healthcare facilities of what to do in those types of situations. So everyone is aware, everyone has been gearing up with plans now for weeks to months, and so they should be prepared.
Does most doctors' offices or hospitals, do they have test kits, and are there enough in the state?
So right now all testing is being facilitated through the state health department. The Alabama State Health Department is equipped to run respiratory tests for COVID-19 as of yesterday. So that is where all of our testing will be performed. Prior to that, all testing was facilitated through the state health department, but delivered to the CDC for appropriate testing. We hope in the next week to 2 weeks that here locally at UAB we will be able to do our own COVID-19 testing.
Is the coronavirus as a whole something you see getting worse before it gets better?
We're not sure what it's going to do. I think as you all know, it's a situation that changes rapidly, minute to minute, hour by hour. And so I think in the next, several days, several weeks, we'll have more information about what will happen in the country.
There's a lot of myths floating around social media, like people not buying Corona. Can you recap ways to actually prevent the virus for people who are still sharing these concerns?
Sure. You're right. There are a lot of myths going around about the coronavirus, COVID-19 specifically. I would direct people to the CDC's website for common myths and frequently asked questions, as well as UAB news/coronavirus for other information. But ways that everyone can protect themselves. Wash your hands. I cannot stress enough, wash your hands. Soap and water works just fine. If you have hand sanitizer, that's great as well. Try and avoid being around anyone who is sick. If you yourself are sick, try and practice appropriate respiratory etiquette. And so what that means is if you're coughing and sneezing, try and use a tissue or the sleeve of your coat or arm to cover your nose or your mouth. Try and avoid touching your face with your hands as much as possible. We know that this is transmitted via respiratory droplets, and we know that this virus can live on droplets on surfaces for some period of time. So the less times that you touch your face, your eyes, your nose, your mouth, that's protecting yourself.
For UAB to become a test site, what's involved with that?
The Children's Virology Lab here at UAB and at Children's Hospital has been working very hard with leadership here at the health system as well as with the FDA to get the appropriate testing equipment in place and get it validated so that way we can run test samples in their lab. Once that is available and validated, we should be able to get testing up and running hopefully within the next week or 2 weeks.
How well, we hope it doesn't happen, but how well would you say that we are locally prepared if something like this does come through?
So UAB specifically, we have been preparing for this now for months. We have stayed very in tune with what's going on around the world as well as nationally and semi-locally now it seems. We have plans in place and we are perpetually working on outbreak situations, simulations, screening, and our response for what we will do if we do get a case of COVID-19 in our health system.
UAB is working on a vaccine, or they're part of the group out of Emory that's working on
Correct.
it. Do you have an update on that?
So there is a vaccine that UAB is affiliated with that is coming through the NIH. It has gone through animal model testing and looks to be fairly promising. And hopefully we'll begin human trials in the next month to 2 months. Unfortunately, vaccines take a while to produce, and so I think the earliest that we are likely to see a vaccine come on the market where we can receive it more broadly is at least a year away. What I would stress is I think it's remarkable that this virus has been identified now for a little over 3 months, and at this point we have been able to genetically describe the virus. We have drug trials in place and a vaccine candidate already through animal testing, and I think that's quite remarkable. Very quick.
If somebody got it tomorrow, where would they be taken in this area?
Well, it depends on how symptomatic they are. So if someone has symptoms at home, fever, cough, shortness of breath, runny nose, myalgias, the first thing that they should do is call their local healthcare provider, let them know about those symptoms, and they will be advised based on their symptoms of what to do, whether that is to stay home and self-quarantine and monitor symptoms, or if they are moderately to severely ill, if they do need to come into the health system, they will be instructed the appropriate way how to do that.
But is there a place already in place for that?
There are plans in place for screening. There is appropriate education of our patients in our health system of what to do if they do develop symptoms and who to call. And we have people in place to help support this plan.